I know some people are probably actually literally on lunch, so I don't want to hold you up too long. So again, hello, and thank you for joining us for our very first Lunch and Learn presentation in partnership with the Pikes Peak Library District. Today, we're going to be talking about Medicare and COBRA coverage in the hopes that you don't get bit. So I'm going to start with who we are. My name is Roma. I'm with the Area Agency on Aging through the Pikes Peak Area Council of Governments. And the mission of the Area Agency on Aging is to help residents in the community, in our communities, remain in their homes for as long as possible. And we do that by coordinating and developing systems and programs that help with that mission. And we serve 3 primary counties through the Pikes Peak Area Agency on Aging, which is El Paso, Park, and Teller. Again, this is in partnership with the Pikes Peak Library District, who we've had a very fruitful partnership with for several years now. And we definitely appreciate their sponsorship. My primary role at the Area Agency on Aging is the SHIP program. And the SHIP program is the State Health Insurance Assistance Program, which is a federally funded program that's specifically designed to provide education and assistance on all things Medicare. We provide unbiased information and assistance, one-on-one counseling, and we can help people with information and education on all parts of Medicare. We can help with all options for insurance to go with Medicare, including Medicare Advantage plans, prescription drug coverage, Medicare supplements. We can also help people review their options if they have a retirement benefit that they need to try and understand. And we also help with assistance for those with low or limited incomes, apply for programs that might be of financial benefit to them. The SHIP program through the Area Agency on Aging actually serves 9 counties in Colorado. And every county in every state should have access to a SHIP office in their area, at the very least by a toll-free statewide number. I have listed our toll-free statewide number for Colorado. Anybody who calls that number anywhere in the state will be routed to the SHIP office closest to them. So I'm going to do a 10-15 minute presentation, and then I will open it up for questions. You are welcome to ask questions by unmuting yourself or by typing them in the chat box, and I will get to all the questions as time allows, but we do have an hour, so there should be plenty of time for questions. But we will wait and hold questions until the end of the presentation. I will also be sending out the slides and an additional handout at the end of the presentation to everybody who is registered, just so you have that information, because I wasn't able to send them out prior to the presentation. All right, so again, we're going to be talking about COBRA. Woohoo. COBRA coverage, which stands for the Consolidated Omnibus Budget Reconciliation Act, is basically just that. It's a continuation coverage that allows people who are losing employment to continue their health insurance that they had while they were employed once they leave employment. So it is continuation coverage based on employer group health benefits that they had while they were actively employed, that continues that employment health group benefit after they're no longer employed by that employer. And it can provide coverage for not only the employee, but their spouse and their dependents. There are some requirements from the government regarding COBRA. So COBRA typically only applies or has to be offered by employers who have 20 or more employees, but that does apply to all private sector employers and state and local government employers. The exception to that rule is the federal government employer because they have their own form of COBRA coverage, or faith-based employers. Some states may offer some additional COBRA-like protections above and beyond the federal COBRA mandates. So if you're not sure and you live in another state, you might want to check with that state. Another requirement of the employer is if they're required to offer COBRA coverage to employees when employment ends, they must provide written notice not only of that availability of COBRA when the employee starts employment, but they must also provide written notice again when there's a qualifying event that the employee falls under that may allow them to access COBRA. If an employee has a qualifying event, COBRA will provide 18 and possibly up to 36 months of continuation coverage of the employer group plan. However, the employee who has lost the employment has to pay the full premium for that coverage. So typically while you're employed, the employer pays part, you pay part. When you're using COBRA coverage, it's the same insurance, but you are paying the entire cost of that premium for that insurance under COBRA. So what's a qualifying event to qualify for COBRA? Well, COBRA is available to a covered employee and or their spouse and dependents. If the employee and spouse and dependents were covered by the employer group health plan when employment ends, and that is based on whether the employment ends due to retirement or termination. It can also employment wouldn't end, but if there's been a reduction in work hours for that employee that causes them to lose eligibility for the group health coverage through the employer, that would also be a qualifying event to be eligible for COBRA. In addition to that, there could be some COBRA eligibility for covered spouses and dependent children if not only the above two situations occur, but if there's an additional situation such as the covered employee or the employee who lost employment becomes entitled to Medicare, if the spouse divorces that employee, if that employee passes away, or if any of the dependent children covered under the group health plan lose the dependent status, such as they age out. So employer coverage and Medicare, and primarily what we're going to talk about is how any and all of this affects Medicare or Medicare enrollment. So when you are actively employed and you have employer group coverage through that employment, that employer group coverage will typically cover the employee and can cover the employee's spouse and or dependent children. And again, the employer pays part, you pay part. If while you're still actively employed, you become eligible for Medicare based on turning 65, you can continue to stay enrolled in the employer coverage and delay enrollment into Medicare based on the fact that you're actively employed with employer coverage. If you delay enrollment into Medicare based on that active employment with employer group coverage, it does give you the ability to enroll in Medicare at any time down the road. So basically, while you're still actively employed, you can enroll in Medicare anytime beyond your initial eligibility and up to 8 months after your employment ends. It's called a special enrollment period. So if you choose to delay enrollment into any part of Medicare, whether it's A or B or both, because of active employment with group coverage, when you quit working and are no longer actively employed, you would have up to an 8-month period to enroll in Medicare without penalty, but you can also enroll in Medicare at any point while you're still employed. And at that point, you can tell Medicare when you want that coverage to start. If you are, let's see, one of the things that an employer cannot do is require that you enroll in Medicare. If you become eligible for Medicare, that employer is required to continue to insure you as if you had never become eligible for Medicare under the employer group health plan. They cannot require you enroll in Medicare. They cannot encourage you to enroll in Medicare and drop their coverage, period. They're not allowed to do that. So if you lose employment and you become eligible for COBRA, there's basically two ways this could go. You could either lose employment and actually be eligible for COBRA, or you could lose employment and not actually be eligible for COBRA because of Medicare. If you are enrolled in Medicare, whether it's A or B or both A and B, prior to losing employment, you are eligible to use COBRA, to enroll in COBRA once that employment coverage ends. And the employer is required to offer that option to you. In that situation, if you are already enrolled in Medicare and you enroll in COBRA, COBRA does become secondary to Medicare. Is there a benefit to doing that, since you would be paying premiums for not only Medicare, but for COBRA as well? And of course, COBRA premiums can be quite expensive because you end up paying the full amount of the premium. And in all honesty, the insurer of COBRA can actually charge you 2% more than the full premium in a situation with COBRA. But there may be some benefits or services that COBRA coverage may provide that Medicare may not. The best example was probably going to be if the COBRA benefits have a separate dental plan that you can continue to have, whether you enroll in the medical benefit or not. That might be something, because Medicare does not cover dental. That might be something that you would keep COBRA for. But again, COBRA premiums, you pay the full amount or up to 102% of the full amount of that premium. Some employers may offer to pay part of that premium. Some of them will not. So it would definitely be something to take into consideration as far as whether or not you even want to access that option because of the cost. If it's really, really good coverage and the cost is reasonable, you would want to weigh that against whether it's not such good coverage and the cost may be rather high. Because again, in this scenario, you are also enrolled in Medicare and probably paying a Medicare premium as well. If you become entitled to Medicare after you enroll in COBRA, so say you lose employment in January and you enroll in COBRA to cover you and your family, and then you become eligible for Medicare in March, because your Medicare went into effect after COBRA, be prepared to lose COBRA. COBRA is not really allowed to insure someone if they become effective for Medicare or enrolled in Medicare after COBRA coverage starts. If you were to choose to stay on COBRA instead of enrolling in Medicare, that would not probably be your best choice, because COBRA coverage is not considered a credible reason or a credible coverage for delayed enrollment into Medicare. So again, if you become eligible for Medicare after you've been enrolled in COBRA, then you're going to have to end that COBRA coverage for, at the very least, for yourself, but you would be able to continue to have that coverage for your spouse and dependents. But you'd want to enroll in Medicare as soon as you became eligible to enroll in Medicare, simply because delayed enrollment based on COBRA is not going to be a good enough excuse for Social Security not to penalize you for late enrollment into Medicare. So the bottom line is, if you're eligible for Medicare before you enroll in COBRA, you can use COBRA, you can enroll in COBRA, and there may be benefit to doing that. But if you become eligible for Medicare after you've enrolled in COBRA, you will have to disenroll from the COBRA and take the Medicare instead. There are some extended benefits for people who become disabled while they're employed. So if an employee becomes disabled and has a reduction in work hours or has to stop working because of that disability, they would be entitled to use COBRA for up to 18 months. But there could potentially be an extension of that 18 months if they are approved for Social Security disability once they become disabled. So if someone becomes disabled while they're employed, they can automatically use COBRA for up to 18 months if they lose employment or have a reduction in their hours that loses their eligibility for health coverage. But if they go ahead and also apply for Social Security disability and that gets approved, that could extend the COBRA coverage for up to 29 months total. So it gives them an additional 11 months of coverage through COBRA. Depending on why that person is disabled or what that disability is, would depend on who pays first as far as COBRA versus Medicare, if that person is also entitled to Medicare. Regardless, if someone who is disabled, who is on COBRA, becomes eligible for Medicare, if they have spouse or dependents that are covered under the COBRA, the spouse and dependents could also potentially get an extension of up to 36 months on the COBRA if there is that second qualifying event of that person who's disabled becoming eligible for Medicare. So the bottom line is, regardless of whether or not you continue on COBRA, the likelihood of your spouse and or dependent's ability to continue on COBRA is very good. So even if they're not eligible for Medicare or other types of coverage, they would still be able to continue on COBRA even if you cannot. COBRA, though, may not be your only option. So COBRA is an option for people that guarantees that they have no lapse in health coverage, which can be very important for some people, especially if they have dependents or spouses that need that coverage, or perhaps they're in the middle of medical treatment that they don't want to have any interruption to. It provides that health benefit for that 18 to 36 months, depending on the situation, so that you are continuing to have health coverage. But if you have other options available to you, such as, if you have a spouse who also works, you might want to look into whether or not you could get on that spouse's employer group coverage so that you become the dependent instead of the spouse being your dependent. If you look at that option or take that option, and you can either use that instead of COBRA, because COBRA is not a requirement, COBRA is an option. So nobody is required to take COBRA. It's an option. If you use a spouse's employment group coverage, or instead of COBRA, or when your COBRA benefits are exhausted, then you can use your spouse's group health employment coverage. Because the loss of COBRA would create a special enrollment into somebody else's employer coverage, it wouldn't matter when that happened, because it would probably create a situation where you can enroll in that spouse's employer coverage immediately instead of having to wait for their employer's next open enrollment period. That would definitely be an option to look at. And again, you'd want to weigh the costs of the spouse's employer coverage by adding a dependent or by having the spouse enroll in that coverage. Sometimes it's cost effective, sometimes it's not. Another option you could look at versus COBRA would be going to the marketplace. In Colorado, we opted to operate our own marketplace. We call it Connect for Health Colorado. Currently, enrollment, typically you have to wait to enroll in Connect for Health Colorado or the marketplace for the open enrollment period every year. That enrollment period has been extended for 2021 based on the pandemic until mid-May. But you would always have the ability to use, again, a special enrollment period into a marketplace plan based on the loss of other coverage, COBRA included. Or you may qualify for the expanded Medicaid benefit or children's health insurance plan through Medicaid for the dependent children. Expanded Medicaid eligibility is based on monthly income and household size. Children's health insurance plan is based on the fact that a child may simply not have the ability to be covered under a parent's employer coverage of some sort through either parent. And so the the financial eligibility is much more generous. But those are all other options that you'd want to explore and compare costs against versus COBRA. Again, COBRA is an option, it's not a requirement, and it could be a good option, or it could be a not so cost-effective option. And definitely would want to look at all of the options that are available to you. If you are looking to compare marketplace costs, if you go to the Connect for Health Colorado website, you can use their estimator, their calculator, to compare the different types of plans that they have available and the different premiums that are available for those plans. And you can also look to see if you may qualify for tax credits or premium subsidies on that coverage. Income limits to qualify for tax premiums or the tax credits and premium subsidies can be pretty generous depending on household. But they have a calculator on that website that allows you to punch in just some generic information to see if you may be eligible for those kinds of things before you actually, create an account and set that up. So the bottom line is explore all options, find out what all of your options are, and make sure that you choose the most cost-effective and the right option for you and your family. The concern typically with COBRA is many people tend to enroll in COBRA and not be aware of the fact that eligibility into Medicare or eligibility for Medicare can affect COBRA coverage. I have seen in the past where people enrolled in COBRA when they probably should have enrolled in Medicare instead, and the COBRA insurance found out about Medicare like a year later. What happens is COBRA coverage can terminate your benefit based on the fact that you should have enrolled in Medicare when you became eligible. Not only did they terminate the benefit, but they went back and took back any monies they had paid any medical providers for that year that you should have been enrolled in Medicare. And that person got stuck with a bill from all those medical providers because the insurance just took all their money back. So COBRA can and probably will backdate any termination if you should have been enrolled in Medicare or could have been enrolled in Medicare. And it creates a huge, ugly billing situation for people who received medical services in that time frame. So again, if you're eligible or enrolled in Medicare before you elect COBRA, you can use COBRA, may not be cost effective. Or if you're eligible for Medicare after you've enrolled in COBRA, you probably shouldn't stay on COBRA, and COBRA will probably terminate you if they find out about Medicare. But your spouse and dependent would be allowed to continue with that coverage. And that's just the tip of the iceberg. COBRA laws can be very complicated, they can be very confusing, and they're managed by multiple federal agencies. And that doesn't help the confusion at all. Again, I will be sending everybody who registered for this presentation the slides for this presentation, as well as an additional handout of frequently asked questions that is put out by the Department of Labor. So keep an eye out in your email for that information. But otherwise, that's pretty much all I have. So I will open it up for questions. Again, you can just unmute yourself and ask your question, or you can type a question into the chat box and I will